My name is Ian,
My name's Haley.
and we're talking about Fragile X syndrome.
Fragile X syndrome is a genetic disorder with intellectual disabilities. Symptoms include delay in talking or speech impediments, anxiety, hyperactive behavior. You can have seizures and you're aggressive. You have large ears and a long face, prominent jaw and forehead. And you can see his face is longer than usual. And his ears are very big. And he's cute.
The prognosis for Fragile X, your life expectancy is the majority of people with Fragile X syndrome live a normal lifespan as anyone else. The quality of life, most females experience ovarian failure and cannot have children, and they also produce lack of estrogen. People with Fragile X syndrome usually experience mental and physical disabilities, and half of females and most all males with Fragile X live all their lives in mental retardation.
This would affect our lives because if I had Fragile X syndrome, I couldn't be up here presenting. I probably wouldn't even be in this biology class. Probably have to be in a special ed class, or I probably wouldn't even go to school maybe.
And me, I wouldn't be able to, play sports, basketball, because there's a lot of physical handicaps in Fragile X syndrome.
We wouldn't be experienced with social media.
So our social life would be a lot less, making friends, social media with this disorder.
And our parents would always have to be with us and take care.
Treatment. Fragile X syndrome is not curable, but treatment can lead to more normal lives. The daily medications consist of folic acid, valcafen, and clolidine, and etc. There are different types of therapy, such as medical geneticists, which diagnoses and manages hereditary disorders, speech therapists that help with speech rehabilitation, occupational therapists who improve daily living and work skills in these patients, and physical therapists can help restore muscles and strength function through exercise. So these are some therapies that can help them get to a more normal life. Although you can take steps to improve this disease, they will still lack educational and physical ability. And there are clinical trials going on with medicine to stop FXS at its source. So it's still in clinical trial. It's not approved yet, but yeah.
The occurrences both genders can get Fragile X syndrome, and they can also both be carriers by it. It's really any family that carries the FMR1 gene, so it gets passed down to all the generations, and it gets worse as it goes down. 1 in 4,000 males get it, and 1 in 8,000 females get it, but there's fewer than 200,000 U.S. cases per year.
The gene FMR1 is on the X chromosome and increases the number of CGG trinucleotides, so it repeats the 5' end untranslated region of FMR1. There is a pre-mutation in which 1 in 151 females carry and 1 in every 468 males carry. The pre-mutation will expand into the full mutation as passed down to further generations.
This is our Punnett square, and this disease usually affects more males more severely, and the disorder is more dominant, and I don't know why. And we did a infertile female, so she doesn't have the disorder, and then a male with the disorder. and we got a female with a disorder and then a healthy male. So it's 50% for the female and 50%